Hello, everyone. We're really excited, thrilled to join you today at Bread and Net. We'd like to thank the organizing team and for providing this space. Really also personally thank the organizers for inviting me to join as member of the advisory committee, and the whole staff, especially Musa, for the coordination and all the great work. So today I'm joined by my colleague Selma Zaki, both of us coming from team community at Article 19. We're going to present to you our one of first publication, the Community Health Report, and have a discussion with you. So I'm gonna probably open the platform venue-less to see your comments in the chat. Okay, so first, who we are. My colleague Selma is the Director of Community Mental Health, and I'm a Senior Community Operations Manager and have been before co-leading the regional monthly meetups. I'm gonna tell you also very soon more about the meetups. But first, I wanted to let you know a little bit more about our team and our community. Probably you're familiar with our global gathering. We've been to it before with the Internet Freedom Festival. Our team works to strengthen resilience, improve capacity, equity, and collaboration between digital rights networks and activists. We provide infrastructure and resources to create events, gatherings, and we love to call it magic, glitter magic, community building services, and we used to have also emerging communities programs through a fellowship program where young professionals interested in working at the intersection of tech and human rights were able to collaborate with the organizers of the global gathering and bring their voices and ideas. We also, STEAM community, have a service branch to help community networks, CSOs, human rights organizations, to develop community networks and programs that are equitable, innovative, centered around safety and security. So we are housed at Article 19. And today we would like to have a collaborative discussion. So I'm going to drop a link in the chat of this pad where you can leave your notes. If you have any questions, please feel free to use this pad. So I'm going to take I'm going to take a second to let me stop sharing. I'm going to take a second to connect to venue-less. Sorry, I should have done this before joining. Muting myself, so stage before joining. Okay, here we are. So I'm gonna drop you the link so you have it from now. Here. Okay. So I'm gonna start sharing. Okay, here we are. So wanted today to highlight the inspiration behind team community, digital rights community, coming from different movements around the world, social justice movement around the world, Black Lives Matter, Dalit women, Taiwanese open source community, indigenous activists, LGBTQI advocates, and wanted to give like a special mention to the anti-censorship campaigners like Freedom, like Free Cats on Cat 404, which was the anti-censorship campaign by Tunisian activists and bloggers, including Lina Ben Mhenni, human rights activist and blogger Lina Ben Mhenni, who left us. May she rest in peace. Our community is composed of like different people who are in the ecosystem of technology and human rights, from journalists, policy advocates, technologists, open source technologists, developers, researchers, who would like to share their experience of being subjected to or fighting against the most acute forms of surveillance, censorship, and digital attacks. Basically, we are a community, for everyone who believes digital rights are human rights. Over time, our community's focus has widened to address issues like online harassment, disinformation, platform accountability, equity, and decolonization in tech, and many other issues at the intersection of human rights and technology. And we could mention here that like throughout these years of organizing gatherings, we've been really in touch, with problems in the tech field, tech ecosystem, being dominated by white cis men, being colonial, discriminatory, and language blind, and connected, like creating this space like to connect with all of these issues when it comes like to safety, creating safe spaces, working on code of conducts and better ways to create spaces for everyone who's interested in human rights and tech, in open source technology. We have different regional meetups. I wanted to mention the MENA meetups, which I co-lead with my amazing activist, journalist, and human rights defender Wafa from Egypt. In the MENA we meet monthly, but we have also other sessions that we call the community knowledge share sessions, where everyone who's working on a new research tool can come and present it to the community, ask for feedback. It's like a spaces for exchange. The monthly meetups are instead like more those spaces is among those spaces that we create for folks to connect, seek help, release stress, and celebrate each other. We try to find ways, to come support each other, and spaces for solidarity. And I want to invite everyone at Bread and Net to join our MENA monthly meetups. And we have later in the presentation, we're gonna leave the details how you can do that. I'm gonna stop sharing for a second. I wanted now to, after all of this presentation of where we are, to present my colleague Selma, who's going to present to us the report. So Selma, I'm really happy to be joined today by Selma, who's my colleague who inspires me a lot. She's a licensed mental health counselor based in New York City, and she has experience in providing therapy services between practices, community mental health centers, and hospital. In addition to providing therapy services, Selma has experience in conducting qualitative research and has been published in the Journal of Counseling Psychology for studying the experiences of gender among Arab American women. As a community organizer in Lebanon, she founded an organization named LESM, which offered events and initiatives that created space for Lebanese youth to collectively identify community issues and address them through creative projects. Selma's goals as a mental health professional and academic and a social justice advocate is to initiate change on individual and collective level. Brings her clinical research community development experience together is the firm belief that healing, growth, and liberation begin in spaces that foster open communication, encourage in-depth understanding. Team Community hired Selma to work on the community health report after observing our community going through the pandemic and this struggle of isolation. And I let Selma take it from here for a snapshot about the report.
Thank you, Rima. Thank you so much for that extensive introduction. I appreciate it. Hi, everyone. I wish I could see all of you. Heads up, my internet is having issues, so I apologize in advance if it's getting stuck. And so we'll just dive into it. So as Rima mentioned, I was hired by Team Community last year to do research and to do this community health report. The community health report provides a snapshot of the well-being of the internet freedom networks around the world. And the goal of the report was to really give the activists an analysis of the current situation, psychologically, and from a community health lens, where are they at? And the report was meant to validate their experiences, but also help and support organizational leaders and decision makers in developing better strategies and solutions for the communities that they serve. And ultimately, the goal of the report is to shift the culture within the community and to normalize focusing on community and mental health. And so if you can go next to the next slide, that would be great. And then next again. Thank you. And then one more. Sorry. Okay. So the main takeaway of the report is that we saw that there's an urgent need for psychological support and conflict resolution resources. Most of the activists have reported that what makes a community healthy is having healthy relationships, but there are a lot of stressors that are threatening the health of the community, including mental health and conflict. There's a lot of conflict in the community that's never addressed or not talked about. And so this is a kind of like a brief summary. And now diving into how the research was done. And so going next, basically it was a mixed methods research. So we did interviews and we did a survey. Over 200 people filled out the survey. The survey was both in Spanish and English. And hopefully, in the future, it could be in different languages. And we interviewed 39 activists. And 11 themes showed up in the interviews. So now what you see on the screen is some of the statistics from the survey. In the survey, we basically asked people, what are the stressors or the traumas or the threats you experienced in 2020 and how did they impact you? If you just glance over the screen, you can see that the numbers are quite high. The first bubble shows the percentage of people that reported that they experienced this stress. And then the second bubble reports people who said they've experienced moderate levels of stress, so 3 or more on the scale of 0 to 5. So some of the stressors we asked about was witnessing or experiencing increasing surveillance, sensitive media blackout or hate speech, experiencing local or regional instability, whether it's political, environmental, or economical, witnessing human rights abuses or experiencing human rights abuses, experiencing loss of work and financial security, and then experiencing toxicity and abuse in professional settings. So as we can see, the numbers are quite high. And in the report, I think 66% of all people who filled out the report reported that their mental health has regressed in the last year. So if we can go next. so as I mentioned, 66% of all participants reported that their mental health has regressed. And then what we did for this presentation, in the next slide, we can see that we also specifically looked at the statistics for people in the Swana region, people who live in the region or are from the region but live abroad. Out of the 200, there were only 21 people from the region that filled the survey, which I think is interesting. And again, we can see the percentage of people that said that they've experienced a stressor, but then the percentage of people that said they've experienced a stressor at a very high level, so that they reported 4 or 5 on the scale. And so loss of work, 50% reported experiencing high levels of stress, local and regional instability, 60%, economic instability, 50%, witnessing or experiencing an increase in surveillance, censorship, media blackout, or hate speech and human rights abuses, nearly 50%. And then in the next slide, I think what's interesting is 80% of people reported experiencing high levels of stress because of their loved ones and people they care about being affected by all the stressors in the world, which I find very interesting, because I imagine you find this more in collectivistic cultures where, we're very much impacted by, we're very relational. And so this was very interesting. And so now jumping into the qualitative research and the interviews, there were so many themes that came up. We're only going to discuss a few of them here. And so here we asked activists, in your opinion, what makes a healthy community? And as we can see, healthy relationships and support was mentioned 26 times out of 39 interviews. So a large number of activists reports that we really need healthy relationships. And a healthy communication was mentioned 17 times. And the thing about all these sub-factors is that they're very much interrelated. We can't have healthy relationships without having healthy communication. We can't have healthy relationships without feeling safety in the relationships. We can't have healthy relationships without being able to, resolve conflict. So even if things were mentioned less, they're all very much interrelated. And so next. Another theme that we asked about is, our assumption is a healthy community comes from engaged members. And what we've seen in the last 2 years is engagement has decreased. And so we wanted to understand, what are the factors that affect engagement. And there are things like access and language and barriers to the space. So a few people reported feeling the space is a bit cliquey and, they didn't feel like it's very accessible. But as we can see again from the numbers, is that most people reported that their mental health and their psychological health was a barrier to engagement. So a lot of the mental health that showed up in the interviews and in the surveys includes like mental health struggles, includes depression, symptoms of depression, anxiety, trauma, loneliness, Zoom fatigue. Actually, a lot of people reported that. And also a few people talked about like imposter syndrome and feeling that they weren't valuable for the community. And so sometimes our insecurities make us withdraw. And another thing that affects engagement is how connected we feel to others, which of course is affected by things like language and whether we get to spend time with these people. So this is one of the themes. The next theme that we asked about is stressors. We asked the activists a very open-ended questions like, what are the stressors that you've experienced in 2020? And as you can see from all these bubbles, plenty of stressors showed up. Loss of work and funding had highest frequency. So a lot of people talked about how either they lost their jobs or they lost funding for certain projects, and they had to go through this period of uncertainty and limbo and high levels of anxiety. And a lot of people are very attached to their projects. And so I remember one person described this experience as having a loved one who's in a coma. And I think when they described it in that way, it was very clear to me how severe the effect of these losses are. global human rights threats had a high number of frequency and also loss of connection. So people talked about how festivals were cancelled and conferences were cancelled, and usually those are the spaces where they get to connect and like see each other face to face and talk about things that maybe it's hard to talk about virtually. And so this had such a deep impact as well. And then after we kind of looked at the impact of the stressors on both individuals and the community as a whole. And so if we go next, we can see how these stressors impact the activists individually, not within their communities. There is an impact on functioning. What that means is ability to make decisions, ability to show up for work, ability to focus, just your day-to-day ability to make tasks and achieve tasks. And then adaptations, only a few people mentioned that, maybe I think it was around 6, but this was like the silver lining. And a few people talked about how they were able to focus more on self-care. They were able to focus more on their hobbies because they had to, because they were in survival mode, so they had to take care of themselves. But really what we see is most people, to be specific, 36 out of 39 activists mentioned a serious impact on their psychological and emotional health. And what was interesting is to see that different stressors impacted activists in different ways. So activists were less likely to feel alone when they felt like other people were going through the same thing. And so the stressors related to COVID, like being isolated, people felt like they felt left alone, knowing that other people were going through the same. But some stressors had a deeper impact, like experiencing toxicity and abuse in the professional settings. I see from how people were talking in the interviews that there was a lot of deep pain that isolated activists even more from the community. And so now looking at the impact of stressors on the community as a whole, the two main impacts were impacts on relationships, both positively and negatively, but most people reported negatively. They said that it was really hard to maintain connections over the virtual world. Initially, they said that there was a lot of effort to stay connected, but people got burnt out and it was hard to maintain connection. And so people were connecting less. And then there was also fear of losing these connections. And then another negative impact was because there's a lot of conflict that's not addressed, there's broken trust and ruptures within the community. And so people engaged less because they didn't feel safe. And one example of this is when I was doing the interviews, I was also holding self-care circles. And a few people didn't want to attend the circles because they didn't feel safe or they didn't want to encounter anyone else in the community. So that's one impact, an impact on relationships. Another impact is we called collective functioning, which means how does the community function as a whole? And we saw that there was an imbalance. The more people felt burnt out and stressed out and psychologically struggling, the more the collective was affected. And so one example of this is a lot of people said that they were in survival mode, so they were unable to do their tasks, or a lot of people felt like they were obligated to others and they didn't know how to say no, which is something I've noticed a lot in the activist community. The inability to set boundaries or to say no because the stakes are high. And so that led to more birth, and then it led to taking on more than one person can take on. And eventually that leads to imbalance, where people feel like they either had to choose between their well-being or their work and their activism. And so that's one impact that we saw. And so then moving into like needs, we asked them about, so we've asked about the stressors, we asked about how the stressors have impacted them, and then we asked them like, okay, do you think there are resources available? And some people said yes, but for the most part, there is a consensus that the resources are not enough. And so then we asked about needs, what are the needs of the community? And as we can see, mental health support was mentioned 30 times out of 39 interviews. And so the numbers are significant. And conflict resolution resources and support was mentioned 21 times. And so that speaks to the needs. And again, yeah, there are other things mentioned, like a few people are living in emergency countries, and so they have very specific needs. And so even if the numbers are, the frequency is less, so here emergency needs was mentioned 6 times, the urgency is as high and as important. There's also clearly a need for more leaders in the community, because there's a few people are caring too much, and I could see that through the interviews. And there's also a need, and there's a deep need and shift in the power dynamics within the funding world, that there's a clear disconnect where some countries have more access than others, and that affects everything from mental health to conflict resolution. And so again, everything is quite connected. And so, yeah, and then the next slide, please. And so these lead us to, we have a clear idea of what the struggles are, a clear idea of what the needs are, and then what. And so now where we're at with team community is, we know that, well, actually, just to quickly summarize and to bring everything together, we can see that healthy relationships are the foundation of a healthy community. And so when there are healthy relationships, community members feel more connected, and then they experience a sense of belonging. And this sense of belonging increases engagement, and eventually it advances the work of internet freedom. So we've also observed that there are many threats to healthy relationships, the two biggest being psychological mental health and conflict and toxicity and abuse within the field. And so that speaks to the need of conflict resolution resources. And what that means is having a code of conduct, organizations having like policies that protect people, just having conversations about conflict. We tend to be very conflict averse. And so connecting this to what we're planning to do as team community, right now we're in the process of building a community mental health program, and it has different pathways. One pathway is research, so we hope to continue doing research and assessing the program itself and whether it works or it doesn't work, but also continuing to assess the community and seeing how our health is evolving as a community. But there's also going to be mental health resources and conflict resolution resources where we work with organizations and we consult them. And of course, there's going to be a lot of educational resources, because there's room to unlearn certain things that have been passed down from generation to generation that don't serve us. I know this is all a bit abstract, and I can't see if people have questions, but if anyone has questions, we'd like to hear more about the needs of, the specific community in the region. But yeah,
Yeah, I
think,
can't see questions for now. No
okay.
questions.
Okay, cool. And so, yeah, maybe we can go next, and one more slide.
Would you like to start with the questions?
Yeah. And so this is basically the summary of the report. Now we have time for kind of like an open discussion, questions. I'd love to, and as someone who's building a program, I'd love to hear more from the specific needs within, Arabic-speaking countries. And so if anyone has any reactions or thoughts, and Rima, maybe you can share the village at the end.
Sure. I'm trying to check if there are questions. Okay.
I should probably try access.
One sec. I'm not sure, like, just to make sure that I'm here, like, speaking to the organizers, like, where can I see the questions? Because there is a question section, but I'm not sure these questions are for us. Okay. Hi, Selma. Shaima is asking, when did you do this study?
Sorry, was that a question for me?
Yeah, for you. It says, when did you start this study?
Sorry. Sorry, Rima, قطش مرتين. Can you repeat it?
When did you start the study?
Oh, when did I start the study? Okay, thank you. Sorry, I apologize. I started the study in August 2020. We started developing the research question, and then in that fall we did all the interviews, and then January 2021 we did the survey to ask about 2020, and then the study was published in May 2021, and then I joined full-time with Team Community the following September. So yeah, it took us a year.
Okay, I put in the chat the link to the community health village. Would you like Selma to say a little bit about present the community health village?
Yeah, so the community health village is part of the educational track of the program. Inshallah, it's something we can do every year, and basically the idea is to bring people that are, I guess, quote unquote experts, even though I don't like that word, but people that, you know, work in conflict resolution and mental health, but also are from different parts of the world and are relevant to this community, to talk about, just to share their tools and knowledge and resources. So we had maybe up to 7 sessions this village, and we have one more session on next week. Sunday next week. And
I can actually share with folks like more details about the session. I'm gonna share my screen again. Okay. So here. So our next session, which is actually, our next community health village session is on Thursday, December 2nd, entitled "Care is Resistance: From Being Detained as a Terrorist to Coping with Prison Guide." And it's a storytelling workshop with Peter Steutner, one of the Istanbul 10, and would like to share with you also the link where you can register for this session. We invite anyone who's attended now to join us. Please stop the sharing. I'm gonna share it in the chat. So here, you can sign up. You can sign up for the session in the chat. We have 2 questions. One question from Rula. What part of the stress was related to COVID, and what part was due to lack of internet freedom, in your opinion? Rula, Salma's mom. Really nice to meet you, Rula.
Great question, Mama. So what? This is hilarious. Okay, what part of the stress was related to COVID, and what part of? So I think a lot of it's hard to measure. I think a lot of the stresses were related to both, but the stresses that were related to the human rights abuses and, you know, they're interrelated, because internet freedom and activism became so much more difficult because of COVID and the situation of COVID, and also because of, you know, the shift in the political landscape in the world. And so I would say that a lot of the stress is related to both, and they're interrelated. But what I'll say is human rights abuses and activism, and people were expected to do more with less resources, and that had a deeper impact. Because people felt more alone and isolated, because it's harder to talk about your traumas than it is to talk about how we're all quarantining, for example. So thanks, Mama.
So we have another question from Jem Barrett. I hope I'm pronouncing your name right. If we are working on projects that relate to community health, then shall we get in touch to share our work?
Yeah, please do. We're very our model is very community driven. And we don't think that good work can come from one organization or one person. And so the more we join forces, the better. And I think, Rima, you had shared at the last slide has contact information. Maybe we can share that.
Yes,
so that people
absolutely.
can reach out.
Yeah, thank you, Selma. I just put in the chat on Venue List our email address. Please feel free to write us at team@digitalrights.community. And we also, I think it's a good moment to share with you more ways like how you can engage with us and join our community. So I'm gonna start presenting again. Okay, here we are. So how can you join us? One of basically one of the things that we wanted to highlight is that while other teams like us who worked on gatherings, like global gatherings, focused on digital rights, physical events, worked on bringing those events online and having this global gatherings like RightsCon or MozFest or Bread and Net, having it online. We in our community we kind of stretched out moments of connection to have it since the beginning of the pandemic, to have it like year-long engagement through our Mattermost space and different regional groups, including the one for our region, and whom I invite all of you intended today to join. You can join our Mattermost space. We have a link that we put in the chat with the instructions how you can join, basically how you can apply for us to send you an invite to our Mattermost space. We invite you to check our calendar of events and to host if you're working on something related to this field, if you're developing a tool, if you recently worked on a research project, if you need feedback and you would like to interact with digital security experts or journalists or activists, it's a great space to host what we call community knowledge share sessions. We have community knowledge share series where you can hold a workshop, presentation, feedback, collaborative sessions, and we invite you. Our community focuses also on ways for those who don't have a good strong bandwidth and good internet connection to have asynchronous ways of communication, and we do that. We don't record our sessions, and we really try to have our space as safe as possible, folks to be able to share their experiences, but we do take notes, and we invite you to check the notes and resources on our wiki. I would like to drop all of those links in the chat. Thank you.
Thank you, Rima. And now, since we have time, which is great, maybe we can have a discussion. There are 2 discussion questions that maybe we can also type out. This one, we'd love to know people's reactions to the research. Does it sound aligned with your experience? Did anything stand out to you? And what was your immediate reaction? And then, what would you say are the needs of the communities you are in, and the needs that the communities that you're a part of? And so, if anyone has any thoughts or reactions, you can put it in the chat.
I'm looking at the chat and I'm pasting the links meanwhile. Please do not hesitate to check them out. For now, I'm not seeing any comments, I think. Give folks like a few minutes, please feel free to like reflect, and no pressure, like if you would like, to check out the report and get in touch with us or leave, some notes in the pad. I'm gonna share the pad again in the chat. I'm not sure how many folks are with us. Maybe the organizers can write it. Because really love to know how many folks are here for collaborative session for more questions.
Yeah, it's tricky because I can't see the who's in the room. But yeah, Rima shared the rise up if anyone has questions, or I don't know if anyone can speak up. I don't think so, right? Okay. Rima, it might be interesting, since you run the MENA meetups, and you're in touch with the community and have organized all these great sessions. I wonder if maybe that's a discussion you can have based on your interactions, and what do you think are some of the, does the research, is it aligned with our regions in specific, and what do you think are some of the needs that maybe wasn't mentioned?
Sure. First, I wanted to highlight how grateful I am for this report. I don't like saying it's the first, but it's it's absolutely one of its kind, in focusing on the well-being of digital rights, specifically digital rights activists, especially being connected with, activists in our region facing, working and operating under repressive regimes, surveillance, censorship, being in touch with communities, with emerging threats, new threats, and stressors before the pandemic, which definitely got worse for a lot of them COVID-19, as this pandemic is not over and we don't know when it's gonna be over. It's the let's say the first observation that you shared about the community, some seeing that the community could be a bit cliquey or tricky to access. That's something that has been shared with a lot of the newcomers through our Swana group. And Swana is a decolonial alternative for MENA. We still are working on having a collective way to move to another name, to Nawa or Swana, Southwest Asia, North Africa. I've seen new folks mentioning how it's been difficult for them to get access to information about funders, or being able to sit on tables related to tech policy, and in general not having enough information, or as women and LGBTQI folks not feeling, welcome in some of these spaces. We do, especially if I'm talking here like in the international like scene for folks from our region, and here like dealing with like colonial and extractive dynamics. I've frankly seen a lot of what has been in the report, like, loss of work, loss of funding, definitely the community, as all, our regional community struggled from the loss of connection and struggled with all the limits, to traveling, but also like some of them like receiving aid, being able to have like collaborations and receive support from other like partners. The dealing like with the human rights challenges, I think it's like the main one, since like 2000 and end of 2010, so 2011, with the revolutions and social justice movements around throughout different countries in our region, and the struggle, continuous struggle for the freedom. And I always say ثورة مستمرة, the revolution is always continuing. We've seen like the pandemic like was one thing, but going through acute, a humanitarian crisis, wars, like in Yemen, corruption in Lebanon, and all what it led to it, with the explosion, like the currency crisis, same like in Tunisia, very like uncertain political moments. If I like just like mention really quickly in Tunisia, where we've had like regression that we're still till now weighing the consequences on freedom of expression and access to information and human rights. I would say that there is a lot more to explore, maybe in here, like Selma, I refer to you because you've been working also on this in access, like the challenge for access to mental health services, which are really needed. In a lot of our calls and monthly meetups, folks were asking about, safe and secure therapists they can trust, also security aware, from the perspective of holistic security and also digital security. There are like a lot of challenges like related to stigma. I wanted like maybe we can talk a little bit about stigma in our region.
Yeah, I think that would be great. Thank you. I saw that someone in the chat said that they had a very bad experience in the space, and that it affected their mental health. So I just wanted to say that I saw that, and if you'd like to share more, we're here to listen. And I think it relates to what Rima was saying, which is, and what I'm hearing is, and this is what I saw in the interviews and what I've experienced as well personally, but there's a lot of layers compounding over each other, right? There was COVID, there's the human rights abuses, there's knowing, comrades and activists being detained and being affected, and then there's internally, and this is maybe especially for women or the queer community, that the loss of safety within the community, and there's all the stigmas that members are faced with, and I think, Rima, you present such an important question. There's a need for mental health services, but there are challenges. One of them is external, which is, a lot of the therapists are in the West, trained in the West, like I was trained in the West, and it creates a disconnect. And even the language that I've been trained in for the last 10 years has all been in English, and that creates a disconnect. And then there are a lot of therapists that don't know the region, and so there's those barriers. But I think there's also the internal barriers of it's not within our culture to go to therapy, or maybe therapy is not the. I think it's equally important to be critical of therapy. Therapy is a Western model. There are different models that work in different cultures that we have maybe yet to explore. But either way, I think we don't make space for conversations about our suffering, and it's difficult. I think, but also because culturally there's stigma and shame, and I've noticed that it's decreased over the years. But I'd love to hear from whoever's in the room. You know, like if there were these services that are available and accessible, like we're trying to build, are people interested in these services? Like, would you reach out to a therapist to talk to? And what are the fears and the hesitations? And so, yeah, I'd love to hear more about that. I also see, Rilla, another question. To answer your question, yes, we do create links between activists in different regions, mostly from the global south, because there's a lot of similarities in their struggle. And so that's the very powerful thing about communities, that they're connectors, which is something I've always admired. But yeah, going back to the discussion, if anyone has any thoughts about, again, needs like mental health services, or, you know, like talking circles, or yeah, if you could come up with something that you needed or your community needed, what would it look like? What would it be? And you can always email us if people are not comfortable sharing. I totally understand. So if you want to email us after and share your ideas, we're always open to discussions and collective brainstorm.
Yeah. Thank you, Selma. I'm gonna paste again our email in the chat. Feel free to write us, and we'll also give the PGP fingerprint for those of us who would like to send encrypted emails. Yeah, I want to just to iterate, Selma, the question of like safety and security. Shaima, who like you mentioned, you had a very bad experience. Please feel free to get in touch with us. We really like to listen. I wanted to say that one of like maybe the main issues in the whole like tech field, but also that in my experience, like with the Swana community, is sexual harassment, especially like for women and LGBTQI folks. There has been like a huge need like to find like solidarities and ways to deal with sexist dynamics in a lot of the organizations, and we've seen also and listened to the need for more information or resources about conflict resolution, but also labor rights. And these are topics that really take seriously and to heart. And our team is working on different programs and resources to address them, including our colleague Dene, who's our community manager. I'm gonna check the chat, see if we have. Yeah, we still have like 5 minutes. Please feel free if you have any, like to leave us in the chat if you have any comments.
Yeah, and I just want to thank everyone at Bread and Net for everything that you've done and the coordination. And I wish I was in Lebanon, to be honest, for this. So thank you so much, and especially for always like following up with us. And so this is great. It's great to be part of this.
Thank you so much, Bird and Net team, and in the community, the folks who have joined us today.
And so if there are no questions or reactions, I don't know what the organizers think, but you have our contact, you can reach out to us. And this is an ongoing, continued discussion. And yeah, we're so grateful to be here, and inshallah, there will be more and more.
Yeah.
So
I wanted to use like this 3 minutes, I guess, left to like just throw it in here for those of you listening. If you would like to participate in this conversation, we're in like a moment of like imagining our next gathering. Like many folks ask, when is the next IFF? When is the next IFF? And due to the risks related to the pandemic and all like the visa restrictions, like unequal access to vaccination in the larger world, we would like to invite you to think with us, how do you imagine the next event? Do you imagine and when? Do you imagine one global gathering, different regional gatherings? What would it look like? Please feel free to join this conversation and let us about your comments. We're also for Selma's program working on providing mental health services. People would be able to ask us for support, if it's like therapy, if it's like educational material. Some of you mentioned you're working on this, feel free to get in touch. But also, if you have feedback about a secure system, secure system that allows to communicate between us, our team and activists. This is some like the security of the communication. We would like to work on a model that could be also replicable and would shift the culture, in our community, but also in general mental health providers, for human rights defenders. I think like that was about it. I guess we would leave it for the next speakers. Thank you so much for this space. Thank you, Selma. I just want to say, it's like a really great report, and look forward to next research. Feel free to reach out. I want to thank the whole team, community team, Jen, Sandy, Victoria, Danae, Rahat from Article 19, who helped us also with the article, and Article 19, who are housing us. Let's keep the conversation going.
And one last thing we'll say is that in the mental health program that will be launched in January, we have free therapy services. So I'm one of the therapists. We have a therapist in Malawi. We're hiring therapists in South America. And then, so that's it. So thank you so much. I think we're going to jump off. We'll stay in touch and take care.
Thank you. Bislema. Bye-bye.